We turn now to reaction from people who were supposed to benefit from the Affordable Care Act here in the News Channel 9 viewing area. John Pless joins us now with more. John.
Well, Calvin, the intent of the Affordable Care Act was to provide some level of coverage to the 50 million or so people in this country who do not have health insurance, namely the working poor, the disabled, and those who are homeless. But they don't see how today's decision will help them.
The most vulnerable people in our community come to the homeless health care center to see a doctor. They just can't afford to go anywhere else.
Medication is so high, antibiotics are so high, pharmaceutical companies, they're making a killing.
The growing number of working poor, homeless people with mental health issues, and the disabled find this as their last resort. They don't see how being forced to buy health care insurance will solve their problems.
Everybody can't afford it, There's a lot of people can't afford it. I don't know how people's getting along now.
Cindy White has been a volunteer and advocate for Chattanooga's homeless for 20 years, and she does not see how the Affordable Health Care Act will help.
If a person can't buy food and can't buy shelter, how are they supposed to buy medical care? They can't.
To force it on them, to say you have to have it, I don't know about that.
Okay. So you don't agree that there should be a mandate?
I don't think there should be a mandate.
Every year, fewer doctors accept government programs like Medicare and Medicaid, creating another issue.
We need some more health care providers because what they're giving us now is not enough.
What do you think the biggest challenge is?
Dollars and cents.
Dollars and cents? It's too expensive?
Not only that, it's poor people. For the most part, I think we're expendable.
There is broad support for the intent of the Affordable Health Care Act, but the mandate is not seen as a solution to a growing problem.
I just have the feeling this is just going to be another straw on their backs, and it's going to make it even harder for them.
The people I spoke with today believe health care has become a political game, and they say they have little faith in elected officials accomplishing any real solutions. Natalie?
John, thanks so much.